Tracy Goncalves is a respiratory therapist who works at Mass General Hospital, BID-Plymouth, and New England Sinai. Tracy recently joined Julie Thompson via Zoom to give us her perspective on the pandemic through the eyes of a healthcare professional.
Thank you so much, Tracy, for being willing to come talk to us today. This must be a very unusual time for you as a respiratory therapist. What is it like now as opposed to before during this pandemic for you?
Honestly, every day it feels like you're going to war, like you're walking onto a battlefield. You have to think more critically. I mean, we always have to think critically, but you have to think more critically than you normally do because every aspect, everything that you do could either, potentially, and you could affect yourself, your coworkers, or other patients. So you have to be incredibly mindful and you have to be very adaptive.
Right.
It's a whole different world. There's a lot of uncharted territory that we're going through. So even still, we are learning as we go.
So you have to be hyper vigilant. I mean, that's kind of the way to put it. Now, can you just, for people that don't know, exactly what does a respiratory therapist do?
So that's a good question. So a lot of people think, oh, we just give nebs or, just place oxygen on people. It's very involved. I think the best way to put it is basically like a specialized nurse for airways and for ventilators. So our main area of focus is obviously from about here to here.
Yeah.
Cardiopulmonary. And there's a lot involved in those two systems. Breathing and the heart go hand in hand. So
Sure.
There's a lot of mathematics. There's a lot of science behind it. And then it also gets into actual atmospheric pressures actually affect the breathing. So
wow.
It's
so
very,
there's so much more than people really understand. There's so much more to this. Now,
there is.
You talked about ventilators for a minute. Obviously, in the news, people hear about ventilators, and people have been on ventilators for an extended amount of time. And people are not left alone when they're on ventilators. Is that true that you kind of have to monitor them continuously?
Yes.
Okay.
So the vents themselves have monitors, and majority of hospitals have overhead alarm systems that the ventilators hook into. So it'll alarm in the hallway. It'll be like a loud alarm that you cannot ignore. And then even at other various hospitals are doing baby monitors, like with cameras, so that way they can constantly have footage of the patient.
Sure.
And there's even some hospitals that the ventilator has a screen that's like almost like a Bluetooth link, so you can actually visualize what's going on the vent outside of the room.
Oh, great.
And you can troubleshoot from that screen.
So you're using a lot of technology to help you actually monitor the patients that you didn't have to do before.
And it's always been there, but it's, as we discussed earlier,
right.
Everything is heightened.
Exactly. There's just so much more of it. Yeah.
So critical.
And do ventilators actually breathe for people? Is that what they do?
They do. So they do a lot of things actually. So right now, with the more acute the patient, the sicker the patient, the more support that we have to program into the vent. So basically, when I'm setting the ventilator, and they're that sick, I'm dictating how I want them to breathe.
Okay.
Based on their blood work and their lab values and things like that.
Okay.
As they start to heal and they get better, we can wean back that support to the point where they're actually doing all the work on their own. And then eventually that starts to get their muscles strong enough.
Sure.
We see that they have been weaned off sedation enough, and we can, take them off the vent and they'll be okay. So there's a science to that too, and a process that we've all been very careful because being intubated is not fun to begin with.
Sure.
And we certainly don't want to have to re-intubate somebody that wasn't ready to come off the vent. So
Right.
we're very careful about that.
So they're in all the math and all the different factors that you have to put together to decide what the next steps are. Yeah.
It's that and good old-fashioned just
Yeah.
looking at your patient.
Sure. Yeah, absolutely. That wonderful interaction, that human interaction. What are some of the tips you have for taking care of your respiratory health, all of us, during an outbreak? What can we do on a daily basis?
So, I mean, if you have allergies, take your allergy meds because, you can't help the psychosomatic effect. Even when I've had a tickle in my throat, I'm like, oh no,
Yeah.
is it coronavirus? So take your allergy med, take your vitamins,
Yeah.
hydrate, just treat yourself well. Drink some green tea.
Right.
Just mindful of your body.
Okay. And your respiratory health is obviously tied to your overall physical health.
Yes.
So,
I mean,
yeah.
if you're asthmatic, take your inhalers. If you are somebody that has COPD or has like sleep apnea, wear your CPAPs.
Right.
Do what you're supposed to do. Obviously, if you're on oxygen, don't smoke.
Right. Don't smoke.
You have to tell people that. So.
Right. Okay. In what ways have you personally felt supported by the community?
Oh my gosh, it's been amazing. It's everything from, thank yous to cards to, food being donated to just kind words of encouragement. And that is some of the fuel that, keeps us going. Like when we're having a hard day, and it's the teamwork aspect has changed in the hospital too. And everybody is just working together so well and supporting each other so well and looking out for each other. So it's not even just the public, we're all looking out for each other, but the public has definitely got our backs and that's keeping us strong and keeping us going.
That's wonderful. So the public and each other, and we're hearing that in a lot of frontline workers, that the brotherhood and sisterhood of just being in this together. And you have a different way of viewing this fight than people that are not in the healthcare industry. And that's wonderful to know that you not only have support from the outside community, but you are just pulling together for each other and holding each other and keeping each other strong and safe, which is wonderful. Can you speak about the resiliency of your patients?
So it's funny, so they go through this, some of them, I shouldn't say all of them, because that would be a generalization. Some of them, they'll feel almost like they have the common flu, and it's a rough time, and they'll rest and they'll take their antibiotics and they'll recover. And some of that can be done at home, some of it is done at the hospital. And then as far as the patients that I see, I haven't myself personally prone a patient, which is when we lay them on their stomachs to breathe. Mm-hmm. And that means that they're incredibly acute at that point.
Right.
But we are seeing these patients that are so heavily sedated and so sick, and then eventually little things start to get peeled back, and everything just starts to turn the corner and normalize, obviously in the best situation. And it's amazing to see this person that was completely out of it start to come to. And my unit at Mass General, we are a respiratory acute care unit, so it's a step down from an ICU. Mm-hmm. So I've gotten the gift, I honestly will call it, of weaning these patients, and after they get trachs, because we can only leave people intubated for so long.
Right.
So I've gotten to hear their first words after all this, and I can't tell you how humbling it is. And it's funny because I kind of gush over them, and I'm so excited for them. Like every time I get to pull a vent from a room, every time I get to hear those first words, and I'm like, "You're doing so great! You're doing so great! I'm so proud of you!" And you have no idea how far you've come. And the initial reaction from them, usually, because it does take a long time, just getting your mind clear from all that sedation. They'll look at me initially and be like, "Oh my God, this girl's crazy. Like, what is she talking about?" Like,
what are you so excited about? Yeah, right.
Horrible, but it's the most humbling experience I've had in my medical career, and I've been in the medical field for 11 years now. So, I mean, honestly, it's very rewarding. It's so great to see them. They are an incredible bunch.
That is so
Yeah.
wonderful. And so to the patient, like you said, when they're heavily sedated, you might just be a blur, you know, if they are even aware of you at all. And then when they you see the progress every day. It's almost like having a child and watching, oh, they took their first steps, and oh, they said their first word. And the kid never remembers it, but the parent sure does. So this whole experience for the people that wake up and get better and then realize how bad they were and that you were there the whole time being their coach and their cheerleader, I'm sure you hear after the fact patients must communicate with you and thank you.
I would like to say that we're there yet. They're still so sick that they are rehabbing out of it, so it does take a little while. So I would think maybe in a couple more months,
yes,
we'll see more of that, definitely.
Oh, I'm sure you will.
After they leave their rehabs, and right now it's hard because there's no visitors anywhere.
Right.
We hear a lot from the families. We get a
exactly.
lot of
Yeah, I'm sure you do.
Once the patients are, back completely to their lives.
Right.
We do get a lot of positive feedback.
That's wonderful. You're angels. You really are. And what advice can you have for families and friends of healthcare workers?
So love your healthcare workers a little extra. As we keep going through this and it becomes kind of our workplace norm, it gets a little bit easier for us to process and deal with the daily stresses, as opposed to, at first it was incredibly high anxiety all the time for us. And that has subsided, just like I said, because for us, unfortunately, it's the new norm. But, just make us dinner, make us coffee, write us a little note.
The little things,
little sentiment. After a 12-hour shift, tell us to wash our feet and then give us a nice foot rub.
A foot massage, yes. Yes, that would be good. And my last question is a question about wearing masks. Now, clearly, it's not a difficult thing to do. It's or facial covering, if you don't want to call it a mask. There's some controversy on why do I have to wear one? I mean, really, I'm staying 6 feet away from people. Why do I have to wear a mask? What, as a respiratory therapist, what do you say on the subject of wearing facial coverings in general?
So, with this whole thing, we've just been kind of learning as we go. Everybody globally, and in the United States, we've all been learning. You know what? For right now, I think we kind of have to suck it up with the mask. If you think about it, okay, so yes, we're standing 6 feet away, but if you cough, if you sneeze, that creates a particulate and that spreads through the air. And so you might be 6 feet away from me, but I might breathe in some of those particles.
Right.
And if you're positive, then it puts me more at risk for getting the disease. And it's not, maybe healthy people think, okay, well, I have a strong immune system, I don't need that. And that may be true. We all are still learning, but we have to think about protecting our elderly parents,
sure.
Are immunocompromised. My husband's a type 1 diabetic. I worry, every day about getting him sick. We have to protect those people. That's what you need to think of when you put that mask on. And you know what? Some of them are pretty cute. So
some of them are pretty funny.
With your outfit, and then take them off when you get home, or get in your car.
And it's a small inconvenience compared to the potential good that it can do.
Exactly.
Yeah.
Exactly.
Right. And I think that the final thing to say is, because people have this virus and are completely asymptomatic, that becomes problematic too, because you might feel great and you might have it and you don't even know you have it. And that's why until we have more data, until we have a treatment and eventually a cure or a vaccine for this, what's it going to hurt to do this while you're in public for a while?
Right. And you know what? As they're saying, and as the regulations come out as far as, things reopening, I think it'll make it a lot easier for things to reopen if we do wear the
Right.
masks.
Right, I agree. Well, Tracy, thank you so much. This has been wonderful. We so appreciate what you do every single day. You are heroes to us. I know you might not feel that way, but your whole industry is just amazing, what you do every single day, and we appreciate you, and thank you for joining us here today.
Thank you for having me.